Hey there, viewers! Cancer scares all of us. However, a lot can be done if it's diagnosed during the early stages. In fact, there are cancer survivor statistics for various types that will tell you the percentage of people who have survived cancer for a specific amount of time. For instance, the overall 5-year survival rate for bladder cancer is 77%. In today's video, we'll discuss the early warning signs of bladder cancer. Can pain while urinating be an indication? Are blood in the urine and pelvic pain early symptoms of bladder cancer? We'll be talking about all this and more. Number 1. Blood in the urine. Have you been noticing a reddish tinge in your urine? Are you experiencing blood in your pee? Medically, this is known as hematuria and is often a sign that something isn't right with your kidneys or other parts of the urinary tract. People who have kidney stones often experience hematuria when they are about to pass a stone through urine. But there could be a more dangerous disease lurking in the shadows. Blood in the urine is considered one of the earliest signs of bladder cancer. A lot of the time, the amount of blood is well enough to change the color of your urine to orange, pink, or even dark red. However, you should know it's not necessary for the pee to be completely red or pink. Several cases have been reported where the color of your urine is normal, but a little amount of blood is found when a urinalysis is done. This urinalysis is usually a part of a general medical checkup. That's why regular health checkups are necessary. Another thing to remember is that the blood in the urine isn't always consistent. You might have it one day and then not experience it again for a while. It may even take weeks or months to reappear. In its early stages, the bleeding will be painless. When you notice even the faintest streak of blood in your urine, even for the first time, get a proper checkup. Number 2. Pain or burning sensation during urination. Do you feel a burning tinge every time you pee, or slight pain while urinating? There could be several reasons for painful urination, but unfortunately, one of the common reasons is bladder cancer. Painful urination or dysuria is experienced by 20 to 30% of the patients diagnosed with bladder cancer. You could be experiencing related symptoms like the urge to urinate frequently, the inability to urinate despite a full bladder, and an urgent need to urinate without having a full bladder. Together, these are called irritative bladder symptoms. Interestingly, while several of the patients show one or all of these symptoms, there are a few who do not experience any irritative bladder signs. Statistics show that 80 to 90% of bladder cancer patients experience blood in their urine without any pain or burning sensation. Clearly, these symptoms are not as common as hematuria. But why does this burning sensation or pain even occur? You get the burning sensation due to the cancer cells that begin to grow on the lining of the bladder. Irritative bladder symptoms like burning or painful urination are also caused by cancer cells gathered together to form tumors in the bladder lining. Consulting your healthcare provider is the best option after experiencing a burning sensation while urinating. It's important to get to the root of the problem ASAP. However, don't get spooked just because it stings. It isn't always the bladder cancer behind this. You might have a urinary tract infection, UTI. In the case of several UTIs, the burning sensation is the first symptom. And if you're a woman, you have a higher susceptibility to UTI-generated burning sensations. If not UTI, it could be a sexually transmitted disease, medication side effect, or enlarged prostate. Even cancer treatments that involve the use of chemotherapy or radiation can result in painful urination. Are you enjoying this list so far? Well, this next point will surely surprise you. But before we continue, why not subscribe to our channel for more videos like this, and hit the bell icon so you're always up to date. Number 3. Pelvic pain. If you've been experiencing pelvic pain for a while, you might want to investigate. Pain in this specific region can be the product of cancer cells growing in and around the bladder. Pelvic pain is a common issue among women. Statistically, more than 3 million American women live with pelvic pain, but thankfully not all pelvic pains are related to bladder cancer. It can either be sudden or long-term. Just so I don't scare you, let me go through the other common causes of sudden pelvic pain. It can be caused by appendicitis, an ovarian cyst, or acute pelvic inflammatory disease. Pelvic pain is also experienced by people suffering from peritonitis. That is the inflammation of the abdomen's lining and urinary tract infection. Even constipation and bowel spasms can leave you with uncomfortable pain in your pelvic region. If you've been experiencing pelvic pain for a long time, it's time to get a checkup done. No self-medication. Now that we have sudden pelvic pain out of the way, what about chronic? Pelvic pains that exist for more than 6 months are generally identified as long-term. The chronic pains are more intense than menstrual cramps and last even longer. It can be due to the growth of cancer cells in your bladder or chronic conditions like endometriosis, chronic pelvic inflammatory disease, or irritable bowel syndrome, IBS. The good news is pelvic pain is rarely caused by bladder cancer. More often than not, it turns out to be pelvic floor dysfunction, causing tightness in the pelvic muscles. This can make the pain in the bladder worse. Before we move ahead, here's a video you may like. Want to know about the 10 weird body changes that are happening due to an underlying serious health issue? Watch this video and learn. Number 4. Back pain. If you have constant back pain and there's no other clear source, you may have bladder cancer. Pain in the lower back or abdomen can be caused by bladder issues. In fact, back pain is very common in patients suffering from metastatic or advanced stages of bladder cancer. However, your back pain will exist with other symptoms, the most common being problems or changes concerning urination. If you're experiencing lower back pain along with blood in the urine, your risk for bladder cancer diagnosis is higher. A physical examination along with laboratory tests like urine will be needed to diagnose the exact cause. In some cases, a procedure called a cystoscopy can be prescribed. It's a process wherein a tiny camera is fit on a thin tube-shaped instrument and inserted inside the bladder through the urethra. This instrument views the inside of the urethra and bladder. It also collects small tissue samples for biopsy to check signs of cancer cells if needed. If your report comes out positive, further testing will be prescribed to check the extent of infection in other parts of the body. Expect to get yourself through CT, CAT, scans, MRI, X-ray, and bone scans. Just so you know, back pain doesn't always point to bladder cancer. It could also be kidney stones, hernia, or a stomach ulcer. Certain infections and fractures or muscles also give you debilitating back pain. Number 5. Frequent urination. Do you find yourself heading to the bathroom more often than you used to? In rare cases, the urge to urinate is associated with the presence of cancer cells or tumors in the bladder. Around 20 to 30% of patients diagnosed with bladder cancer show common irritative bladder symptoms like frequent urination. However, you can detect symptoms early on. Frequent urination can easily be a sign of conditions like a benign tumor or infection. Remember, healthcare professionals stress that early diagnosis itself is a cure for certain cancers. The biggest problem with early diagnosis is that several symptoms associated with bladder cancer are very similar to those seen in urinary tract infections. Pathologists grade bladder cancer between 1 and 3, where a lower number indicates cancer of a low grade. High-grade cancers are more powerful and invasive by nature. If you do get a positive report, please do not panic. You may be able to breathe a sigh of relief. First of all, bladder cancer is rare, and the survival rate is good. For bladder cancer in the natural position, the survival rate is 90%. For localized bladder cancer, chances are also 70%. Also, bladder cancer tends to grow slowly and is less likely to spread. Did you know about these early warning signs of bladder cancer? Let us know in the comments below. We would love to hear from you. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait! What kind of bestie are we if we don't tell you about our other awesome videos? Go ahead, choose the left or right video, and enjoy.